Hey, Dr. Leah here with another health tip for you. There are certainly some health benefits to being vegetarian or vegan, not to mention all the environmental benefits. However, one concern with these diets is the risk of B12 deficiency. There are also certain medical conditions and prescription medications, which I'll get into in a minute, that can negatively affect how we absorb B12 and thus lead to deficiency. So what exactly is vitamin B12 and why is it so important for good health? Well, vitamin B12 is water soluble and is naturally present in animal product foods, such as land animals, fish, milk products, and eggs. What B12 actually does in the body is it serves as a required cofactor or a helper for some crucial enzymes to function. Another enzyme that uses B12 is this L-methylmalonyl-CoA mutase, which serves in reactions involved in fat and protein metabolism and hemoglobin synthesis. Now, you won't be quizzed on these details later, but the take-home message here is that B12 works all over the body all the time. So what does it feel like when we don't have enough B12? What are the signs and symptoms? Well, anemia, fatigue, weakness, constipation, loss of appetite, and weight changes. Also, neurological symptoms such as numbness and tingling in the fingers and the toes, issues with balance, depression, confusion, dementia, poor memory, and soreness of the mouth or tongue. In babies, signs of a B12 deficiency include failure to thrive, movement disorders, developmental delays, and anemia. Okay, so what are some of the causes of B12 deficiency? Obviously, first is a lack of adequate dietary sources, which is pretty much limited to vegans and sometimes vegetarians. Another cause of low B12 is inability to absorb the B12 from your foods or supplements. B12 from food is bound to a protein in the food, and it's hydrochloric acid and gastric protease in the stomach that actually have to break the B12 off the protein. Then you need intrinsic factor, which is secreted by parietal cells of the stomach, to combine with the B12, and only then does the B12 get absorbed once it reaches the intestines. So, if the lining of the stomach is damaged for any reason, the cells that create the hydrochloric acid and intrinsic factor can't do their job. If a person has had a surgery such as gastric bypass or removal of part of the intestine, they're at higher risk of vitamin deficiencies. As we age also, generally we make less hydrochloric acid, so simply being an older adult puts you at risk of vitamin B12 deficiency. Further, if you're taking any medications that suppress your stomach acid production, such as proton pump inhibitors like Prilosec or Prevacid, or H2 receptor antagonists like Tagamet, Pepcid, or Zantac, you may not have enough hydrochloric acid to properly break down and absorb your nutrients. Metformin, the popular drug for diabetes and insulin resistance, may cause B12 deficiency due to its effects on intestinal mobility and the ability of cells in the intestine to absorb B12. Okay, so here's the punchline. Here's what you can do to avoid vitamin B12 deficiency. First of all, get blood work to find out what your level is. Not everyone with the risk factors I just discussed is deficient, and some people with no risk factors are deficient. So really the only way to know for sure if there's a problem is to get tested. Second, avoid medications that artificially suppress your production of stomach acid. We need our stomach acid for so many more reasons than just absorbing B12. So if you have reflux symptoms, ask your local naturopathic doctor how you can treat that GERD with natural means and keep your precious hydrochloric acid intact. Finally, if you're vegan or vegetarian, or if you find out your B12 level is low for other reasons, take a simple supplement. Vitamin B12 exists in several forms and contains the mineral cobalt. So the forms of B12 are called cobalamins. The forms that are active in the human body are methylcobalamin and 5-deoxyadenosylcobalamin. If you look on your B-complex or multivitamin product label, you'll see the form of B12 it contains written out. Generally, I suggest taking it in one of these active forms, not purchasing products with cyanocobalamin, which has to be converted in the body to be usable. You can ask your naturopathic doctor what dose is right for you. After this short explanation, I hope you better understand the importance of maintaining adequate B12 levels and some of the risk factors for deficiency. Thanks, and until next time, be well.